Thank you for staying with us on this Thursday afternoon. I'm Thami Ngubeni, and this is your daytime update. Now, the COVID-19 pandemic has changed how medical aid schemes and their members behave in very significant ways. Bestmed Medical Aid Scheme says another trend is that members are opting for lower-cost alternatives due to the economic impact of COVID-19. Joining us now to share his insight into the trends as well as the patterns that are emerging as a result of COVID-19 is Bestmed Medical Scheme's CEO, Mr. Dlamini. Mr. Dlamini, good to have you with us on a daytime update today. Tell us about the impact that COVID-19 has had on medical aid schemes.
First of all, good afternoon to you, Thami, and your viewers at home. So in terms of impact, the impact has really been big. As you know, the economy suffered significantly last year. In fact, we still have remnants of that right now. So the industry, from a private healthcare perspective, hasn't been spared. All the schemes have experienced this. First of all, the direct sort of impact, probably categorize it into 5-6 elements, and I'll just go through those very quickly. The one is the direct cost. So the cost of tests, hospitalization, and then out of hospital treatment that where you don't need to go into hospital. That has been the one big impact. The other impact is a lower claims ratio, what we call utilization. So because of the lockdown in 2020, people didn't utilize their benefits. In other words, they didn't go to their medical practitioners, didn't go to dentists, didn't visit their GPs. But also just because of the flu, a lot of people didn't use antibiotics and all that. So there was a lower utilization. But also, you may recall the government negotiated with the big hospital groups to say, because we're bracing for this big impact, can we make sure that there's available beds in the event that we see a catastrophic event? That then meant that people couldn't access their hospitals. That then meant postponement of what we call pre-elective surgeries, i.e., surgeries that are not life-threatening. So you had then a lower utilization across the board in the industry. But something else also happened because of the global impact of COVID. That we know that the economic front was not spared because there's a lot of investments that in terms of member collections, when we collect the money. What we don't use in a current month or a current year, we put away into savings so that we are able to earn some interest so that we can fund members' benefits. Those sort of returns, we saw a lower returns on those investments in 2020. Of course, a lot of the members obviously struggling to just hold on to their jobs, disposable income being hard because the economy was so bad. Others felt that they couldn't go without the medical cover. So what they then did is buy down, which is what we call, it's a common term in the industry, buy down. It's essentially downgrading to a lower benefit option. Of course, the industry also saw no growth in terms of, you can imagine, people don't have money. They are unable to buy into a health cover. And of course, there was the impact on employees. I mean, you can imagine. We're in the business of being available when you need us. When you say you need to do a procedure in hospital, or you need a pre-authorization, it's a life-threatening thing. You'll need to be there to call somebody that will give you that. So we needed to make sure that our staff are safe. So what we've had to do, and I know the industry did this as a whole, sent everybody home, give them equipment so that they're able to then be responsive to the industry. So that was a large part of the impact on the industry from a COVID perspective.
I wonder, Mr. Dlamini, you spoke about the fact that people were not going for the elective surgeries, so there were less claims, even though there were more claims perhaps for COVID, but not for other regular treatments that ordinarily you would have received claims for. Do you then anticipate a backflip regarding this, because those surgeries will still need to be performed at some stage? When COVID has normalized, are you expecting perhaps an influx of claims that should have been done during COVID but were not?
Thami, it's a great question, because this is a thing we've been grappling with as an industry. First of all, let me say this. In 2020, just to give you a sense, what we saw, I'll talk about the specific MICE scheme. we saw a 13% reduction on that utilization, which meant that you had a 13% room to be able to absorb the costs, additional costs, which you hadn't planned for of COVID. But what we're seeing now, we're seeing the reverse. I mean, in the last 4 months, that's why I'm saying this question is very critical. The last 4 months, what we've seen is we've seen claims, the utilization going back to pre-COVID levels. And in fact, in certain instances, it's slightly higher than the pre-COVID. If I give you a sense for my scheme alone, just in the month of August, I've seen a difference if I look at the 2019 claims profile versus the 2021 claims profile. There's about a 45 million swing deeper. So we're definitely seeing that's happening. So what this means now, unlike 2020, what we're seeing now, at least in the last 4 months, and we think it's probably going to continue into the future, is that now you have utilization back at normal. But then you have to then overlay that with the cost of COVID, which is not insignificant cost. So now you then sit with over 100% utilization. So you're getting contributions, but you're actually spending much more than what you're getting in.
And how is this then, Mr. Dlamini, going to impact the contributions that medical aid users are going to be making? Is there going to be an increase there?
Fantastic question, Thami. So because of that kind of, you'd expect, and that's typically what a medical scheme will do. We'll say, we're actually paying out more than what we're receiving. Therefore, it means we've got to increase our prices so that our contributions come up to the utilization level. Now, because of the good year, in other words, the lower utilization in 2020, a lot of the industry as a whole built up its reserves. Now, those reserves are specifically for those situations where you are in a situation where the claims are higher than your contributions. So the reserves should be able to absorb that. And I want to say this, the industry can absorb the higher claims. The question that you asked specifically, how will this translate into price increases? First of all, the industry can, and the CMS had asked us to make sure that our prices, worst case scenario, are at CPI, best case scenario actually at zero. Because industry is aware, the CMS is aware that the reserves are higher. So with the reserves, we should be able, as an industry, to give very modest increases for next year. Let me give you a sense from a Bestmed perspective. This year, we increased our contributions by 4%, which was the third lowest in the industry. Going next year, just last week, Friday, we announced our increase for 2022. We are increasing our contribution by 3.9. Now, you might have seen some of our competitors have come out 6.3, others 4.8. We think that ours is possibly going to be one of the lowest. But this is because we have healthy reserves. Let me also say this. We didn't just get healthy reserves because of COVID, but we already had healthy reserves coming into the COVID period. So we will be able to then extend those very competitive prices.
Further into that. Now, we know that the COVID costs can be very high for members, especially those who do fall ill. What do medical schemes cover?
Right. So it's specifically around COVID costing. And this is, again, a very important question. So COVID has been declared what they call a PMB, prescribed minimum benefit. Now, a prescribed minimum benefit is a medical condition that's been prescribed by the regulator through the Act that says, regardless of the option that Thami has, whether Thami has a hospital plan or a very comprehensive plan, Thami will get access to full cover of that condition. This is to safeguard members, because as people will buy into hospital plan, certain things may not be covered, but a PMB is covered in full, obviously at scheme rates. COVID on the onset, and this was done with the CMS, was then declared a PMB, which means that it's covered in full. Let me give you just another sense, a statistic. From a Bestmed perspective, if you are admitted tomorrow for COVID, the average costing for you staying in hospital with us has been about 130,000. Now, not many people can. In fact, it wipes out all your contributions that you've given on that. But fortunately for everybody, and members need to be aware of this, and in fact, people should think about joining medical schemes because they will be covered in full for things like COVID. And then with things like long COVID, you don't know where that's going to end up.
Well, Mr. Leo Dlamini, thank you very much for that conversation. Some really important information to know, especially in the season of COVID and even beyond. Thank you very much for that update. He is the CEO of Bestmed.